intervention and crisis care that practitioners have seen in decades. The 90-day continuum of care provides someone to call, someone to respond, and somewhere to go for any individual experiencing a mental health, substance use, or suicidal crisis. Core components of this continuum include the 988 Suicide and Crisis Lifeline call centers, mobile crisis outreach response teams, crisis receiving and stabilization centers, and crisis diversion homes. Introducing the recommended 40-cent monthly fee on all mobile phones in New Jersey would support this continuum as utilization increases and federal funding sources become more and more unstable. This fee has been legislated nationally and has been successfully implemented in 10 other states. The evidence-based approaches utilized throughout the 90-day continuum of care prioritize addressing behavioral health crises early on to reduce unnecessary hospitalizations, avoid trauma, and enable people with behavioral health conditions to remain in their communities. With these goals in mind, we also support fully funding the state's certified community behavioral health clinics, also known as CCBHCs. CCBHCs use evidence-based models to provide integrated behavioral health care in community-based settings. Fully funding these sites allows them to maximize their impact and reach more people in need of behavioral health services. We asked the legislature to pass telecom fee legislation once introduced and to continue fully funding both the 90-day continuum of care and CCBHCs. Doing so would improve access to behavioral health services throughout the state and save lives. Thank you so much for hearing our testimony.
Thank you. Thank you, Abigail. John Indike, Healthcare Association of New Jersey.
Good morning, Chairman Sarlo and members of the Senate Budget and Appropriations Committee. I am John Indike, Vice President of the Healthcare Association of New Jersey, our state's oldest and largest long-term care trade association. Thank you for this opportunity to discuss the next state budget and how we can better serve the more than 28,000 frail elderly Medicaid beneficiaries cared for in our nursing homes and assisted living communities. As we begin the next budget cycle, the fear of substantial cuts to Medicaid at the federal level weighs heavily on everyone's mind. I want to put that focus on possible federal cuts aside for now. HCNJ was shocked to read in the proposed budget details that nursing home Medicaid rates in effect on June 30th, 2024 would be used to calculate the FY 2026 rates. That would reduce reimbursement for the care of our most frail and vulnerable seniors who reside in nursing homes by $67.2 million. The Department of Human Services has assured us that there is no cut proposed for nursing home Medicaid reimbursement. They said that the reference to the 2024 rate is a typo that was intended to say 2025. We hope that DHS can acknowledge this typo to this committee as confirmation that there was never any intent to cut nursing home rates. Putting this budget language aside, HCNJ has 3 requests for the next state budget. First, the next budget must prioritize our nursing home residents. They deserve significant additional funding to cover their cost of care. Next, the budget must stop disqualifying over 1/3 of our nursing homes for eligibility for quality incentive payments. Every nursing home should be incentivized to reach quality metrics established by the DHS. Finally, despite being recognized by the federal rule as a home and community-based service and being funded out of the community-based long-term care recipients state budget line item, assisted living programs have received no increase in base rates since FY 23, despite a 27% increase in this line item over the next 2 state budgets. The proposed FY 26 budget increases this line item to over $1.7 billion, 33% more than in FY 23. Medicaid beneficiaries in assisted living communities deserve a fair share of this funding to help cover their increased cost of care. HCNJ respectfully requests that $5.5 million from this community-based long-term care line item, a mere 0.3%, be earmarked for an across-the-board increase in the base rates for assisted living residences, comprehensive personal care homes, and assisted living programs. In closing, more than 28,000 frail, elderly, and disabled Medicaid beneficiaries rely upon nursing homes and assisted living communities for their daily care. Please make them a priority in FY 2026 state budget. Thank you for your time and consideration.
John, the supplemental appropriation that the legislature added was cut, correct?
Yes, that's by the budget language.
Okay.
Yeah, we've been told that that's a typo, and we would encourage them to recognize and acknowledge that before the committee, so we're not starting, from behind the 8 ball.
I love the response. It's a typo. Love it. Okay. Next three up, please get ready to come. Doug Felder, first here. Doug Felder, Greg Stankiewicz, Colin Rosier. Doug Felder, First Healthcare Management Company.
Good morning.
Good morning, sir.
Good morning, Chairman Salo, Vice Chair Greenstein, Majority Leader Ruiz, and distinguished members of this committee. My name is Dole Felder, and I'm testifying today on behalf of the New Jersey Adult Day Services Association. We submitted written testimony, so I will just mention a few highlights. Medical adult daycare is the most cost-effective long-term care setting. We actually save the state Medicaid dollars. We provide every discipline available in a nursing home, minus the overnight stay plus transportation. A day of medical daycare includes nursing care, social services, food and dietary services, pharmaceutical services, transportation to and from home, and to medical appointments, as well as therapeutic recreation and more. The other community-based option for Medicaid recipients is home care or PCA services. The current PCA rate is $26.68 per hour. Medical adult daycare costs half of that at just $13.15 per hour, or $19.08 per day for about 7 hours of care. Just 6 years ago, PCA rates were about half of what they are today. As state-mandated labor costs have increased by 66%, their Medicaid rate has increased by 67% since 2019. But that same methodology was not fairly carried across all Medicaid providers. Medical daycare costs have increased by the same 60+%, but our rate is only 17% more than it was in 2019. The average VA medical daycare rate in the entire United States is now $142.12. New Jersey has the lowest rate on the VA schedule because our state Medicaid rate is so low at $92.08. It is 37% less than the national average. This is not sustainable while being one of the costliest states in which to operate. I speak today not only on behalf of providers, but also on the more than 21,000 senior and disabled New Jerseyans that rely on a medical adult daycare to be able to live in the community and not in nursing homes. They rely on our staff to help manage their lives, their health care, and well-being. We are literally the lifeline to the patients we serve. However, our cost-effective centers are losing money daily. NJASA respectfully asks that we increase the rate for FY 2026 to $105 per day. That is just $1.85 per hour more than the current rate. And at that rate, we will still be by far the most cost-effective long-term care provider. We are grateful to Senate leadership and this committee and the legislature for engaging and understanding our industry struggles the last few years, but our costs have drastically outpaced our increases. Thank you for this opportunity to testify, and I'm happy to answer any questions.
Thank you, Mr. Felder. Greg Stankiewicz, the Jersey Community Schools Coalition.
Yes, thank you, Chairman. And I'd like to thank Chairman Sarlo, Vice Chair Greenstein, and all the honored members of the committee. My name is Greg Stankiewicz. I'm the statewide coordinator of the New Jersey Community Schools Coalition. We'll be submitting written testimony that has some resources behind it and our contact information. But for today, for this morning, I have a very simple request for all of you. And the request is to add $3 million to the FY26 budget for expansion of the community school approach so that more of our public schools can take part in what is over a 100-year approach, but that academic evidence shows is extremely effective, and return on investment studies have shown returns up to $14 for every dollar that's invested. What is this approach? It brings together teachers, administrators, students, teacher union members, families, to figure out what each individual community and every specific school building can most use, and then has a coordinator to bring these sources in together from outside providers, whether they be nonprofit, for-profit, or community members. And it really is a vision that John Dewey had of public education bringing all of us together in support of our small d democratic way of governance. Other states are doing this. In the last 4 years, at least 8 states have had their expansion efforts to as a way of trying to support their schools. New Jersey has some great individual efforts, including in Trenton and in Patterson, but we especially need state support now that the federal support is no longer is no longer there for us. And we need it to grow the scale of impact and to signal to private funders and to private philanthropic partners that the state is a willing partner. And they will bring in money if they see that the state is at the table as well. On our part, 2 weeks ago, we launched the New Jersey Institute on Community Schools at the Center for Human and Social Development at St. Elizabeth University. Our goal, to provide any public school in our state with the technical assistance and training if they'd like to explore a community school approach. Our ask to you today is to join us in this partnership. We need the support of the state. And so we're asking for $3 million to support training for more schools and districts to adopt community school approaches. Thank you again for all of your support in the past. Thanks.
Thank you. The $3 million is duly noted. Colin Rozier, Pyramid Healthcare, followed by Anita Clavering.
Good morning, Mr. Chairman, Vice
Colin,
Chair.
before you go, I just want to welcome Senator Gordon Johnson, who has now joined the committee.
Thank you, Mr. Chair. Good morning, Mr. Chairman, Vice Chair, and members of the committee. My name is Colin Rozier with Pyramid Healthcare, which serves over 14,000 people every day with substance use and mental health needs across 80 facilities in 8 states. We operate 7 outpatient locations in New Jersey and a Medicaid residential substance use treatment facility for adults in Hamilton, whose 200 detox and residential treatment beds serve thousands of New Jersey residents every year from throughout the state. We admit 300 clients every month at Hamilton, but are forced to turn away 450 other people because there are no beds available. New Jersey only has 1/10 the beds as Pennsylvania. Current reimbursement rates do not allow or encourage providers to build enough treatment capacity to meet the needs across the state. In fact, Medicaid providers find it increasingly challenging to staff existing beds because the Medicaid rates are not enough to pay staff what they're worth. Many of our patients have already lost family, homes, jobs, and insurance coverage. Without access to treatment under Medicaid, they do not simply disappear. They continue to show up in the community, leading to higher costs for hospital emergency departments, homeless services, foster care, the criminal justice system, and emergency responders. Proper treatment helps break the cycle of addiction and enables individuals to return to productive lives, re-enter the workforce, contribute to society, and helps the state have a healthy workforce without which the rest of the economy cannot thrive. We urge the legislature to appropriate an additional $7 million this year for Medicaid reimbursement rates for residential SUD treatment services. These state funds would also draw down $14 million in federal matching funds from CMS at a 2-to-1 ratio and equates to just 0.1% or 1/1000th of the governor's proposed spending on Medicaid this year. Doing so would raise the short-term residential rate by $50 per day and the long-term residential rate by $100 per day to bring New Jersey more in line with rates in surrounding states. Mercifully, deaths from fentanyl, opioids, and other overdoses are starting to come down. Now is not the time to give up the fight. Now that we are keeping more people alive, we have an obligation to help them actually get better through treatment and recovery. Providers like Pyramid Healthcare do this every day, but cannot continue to do so without the funding needed to recruit, retain, and reward the people who make it happen. Thank you for the opportunity to speak with you today and for your support and commitment to serving New Jerseyans struggling with drug and alcohol addiction. Thank you.
Anita Clavering. Thank you.
Thank you for the opportunity to provide input into the fiscal year New Jersey state budget. My name is Anita Clavering, and I am a self-advocate from Monmouth County. I have been involved in advocacy for 20 years, and I've seen firsthand how policies impact people with disabilities. Today, I want to share why these issues are so important and how they affect individuals with disabilities. I want to discuss the impact of Medicaid cuts on people with disabilities. Medicaid has helped me cover my health expenses and helps cover my on-day adult medical day program. If Medicaid funding was reduced for disability services, no one will be able to get treatment. Medicaid has covered vaccines, exams, and treatments that I have need to receive. Losing access to drug support professionals, DSPs, medical care, and or therapies will impact my daily life as I would be in overall poor health. I would like to urge lawmakers to protect Medicare funding. Eliminating the Department of Education for students with disabilities can also have a big impact. The Department of Education helps ensure students with disabilities get the support they need. Students get extra help with studying and subjects. They get help with programs that can help with their education. Students with disabilities receive any kinds of accommodations that they need to help advance their education. They already have faced many challenges in school, and without this support, it could worsen. They may have a learning disability that requires them to have more remedial help. Losing federal resources can impact access to special education services. It will affect the school personnel, and there will be a loss of funding for programs and resources that are essential. I would like to urge lawmakers to maintain the Department of Education as it's crucial for students with disabilities. People with disabilities deserve access to the services and supports that they need. Medicaid funding and the Department of Education play an important role in ensuring that happens. I urge you to protect these programs and ensure that people with disabilities are not left behind. I want to thank you again for the opportunity to speak on the fiscal year 26 New Jersey state budget and for hearing my recommendations. Thank you.
Thank you for your advocacy. The George Corwell, New Jersey Catholic Conference, followed by Harry Lee, followed by Mary McElroy. George? Okay, I don't see George. We're going to jump to Harry Lee. Harry, you on? Okay, don't see Harry. We're going to jump to Mary McElroy. Mary McElroy with Archdiocese of Newark. Mary?
Yes, here I am. Good
Hi,
morning.
Mary.
Good morning, Senator. Thank you very much for this opportunity, Senator Sarlo and Vice Chair, Senator Greenstein. I represent the Newark Archdiocese, which is the 4 counties of Bergen, Essex, Hudson, and Union, and the almost 150,000 children who attend the non-public schools of New Jersey in this ask. We are asking for an increase in nursing services. Since the legislation for nursing services was enacted in the 1991-92 school year, the per pupil amount has only risen to $130, and we are respectfully asking an increase to $150 per student for nursing services. This is to help us combat the shortage of nurses. It's very difficult to have a nurse in a non-public school, and in any school really these days, but in particularly the non-public schools have been greatly affected by this shortage. We have schools who are not able to have a nurse in school. The non-public sector for schools is not able to compete with the salaries that nurses can certainly earn in other venues. And its shortage is something that harms our students. We have schools that have not had a nurse. We have one school in particular this school year that only had a nurse for a total of 6 days because the provider for nursing services was unable to find and keep a nurse who would work at the school. We know that diseases and medical conditions do not discriminate as to where children attend school, and we have needs in our schools for nursing services to not only care for students, but to take care of the basic testing and health requirements of students and to make sure that immunization records are up to date. When we don't have a nurse, those things suffer, and it's our children who pay the cost. And our families are certainly looking for some help from your committee. We appreciate the help that you have given to non-public school families in the past, and we are counting on your support again. Thank you very much.
Thank you. And I was recently down at the Archdiocese speaking with the Catholic Conference regarding this same matter. So thanks for.
I am here, Senator Sarlo. I've been here.
Okay, George.
Okay, I'll cut it short because Mary said a lot of.
Mary and you are speaking same. Go ahead.
Is it all right to go?
Yes, sir.
Yeah, I'm the Director of Education for the New Jersey Catholic Conference, and the amount we're asking for, as Mary had said, is $150 per pupil based on a $20 increase over the years from 1991 to this year. The amount has only increased by $70, which over 35 years is $2 per pupil. The Department of Education, ironically, just issued a notice saying how important the non-public school nurse or any nurse is in a case of an emergency. And so that's why we need a nurse available all the hours that the students are in the building. The money flows, for those that aren't aware, to the public school district, and then they subcontract to an educational services commission, a special services school district, or a private provider such as Catapult Learning. Now, the problem is that there's a 6% cap in the legislation, but the districts, many of them are kind enough not to take any of it, turn it over to the provider. But many times the provider will mask additional administrative cost under supervision. And as Mary is well aware, the supervisor sometimes comes once a semester, if we're lucky, from the provider. So that's where a lot of it gets eaten up. I have enclosed with my testimony not only the limited duties that a non-public school nurse can do, but also a sample contract that is signed by the school and the provider. I have redacted the name of the school and the name of the provider. But our goal is to try to get as many nursing hours as possible. And that's why we're asking in a tight budget, we recognize for $20 per pupil for the $151,000 listed in the governor's budget for this year. So thank you, Senator Sarlo, and I'm sorry about the confusion for starting in the beginning.
No problem. Harry, I see Harry Lee is on now. Harry?
Thank you, Chairman Sarlo, and members of the committee for the opportunity to testify today on this budget. Harry Lee, I'm the CEO of the New Jersey Public Charter Schools Association. I'm here on behalf of 86 public charter schools serving 63,000 students throughout New Jersey. Charter schools are public schools and have been serving families incredibly well, especially post-pandemic. Charter schools have longer school days and longer school years, about 20% longer on average than other public schools, which has enabled our schools to catch kids up faster than the rest of the state. When it comes to student level academic growth in math in the entire state, 6 out of the top 10 highest growth districts are charters, And in reading, 4 of the top 10 highest growth districts in the state are charters, despite our schools only serving about 5% of all public school students in the state. And growth does take into account academic starting point for students. And so this is an apples to apples comparison with the rest of the state. Black, Latino, and economically disadvantaged students in charter schools are making faster learning gains in math and reading compared to students in more affluent communities. And we have currently 32,000 students on charter waitlists. 90% of our 63,000 students are in SDA districts, about 1 in 5 in the SDAs. 91% of charter students are students of color, and 7 out of 10 come from low-income households. And we want to make sure that all students, regardless of where they go to school, have access to school buildings that are safe, well-maintained, aren't overcrowded, and allow our students to be in a great learning environment. And over the last 30 years, $20 billion has been provided to all different types of public schools, district, magnet, county VOTEC, for their facilities needs, and charters have only received the nominal amount for emergent projects, and they're currently $1 billion in need. Lynn Community Charter School is one example. They have, they're currently split between 2 buildings, K-8 students in 2 buildings, and their building was built in 1908. So there's not much room. They need to make upgrades. And we know that inventory in Newark is scarce with prices on the rise. They're also at the board of 3 wards, and so they just need additional resources for emergent projects as well as a longer-term solution. So our request today is to restore the line item for charter schools for emergent projects from $4 million to $9 million, which is what charter schools received last year. Our district counterparts funding for emergent projects remain the same in the budget, and we want to make sure that charter students are treated in the same way. And secondly, lawmakers created last year a facilities loan program in EDA for charters, and this has not yet been funded. And we're requesting that the loan program be capitalized so that regulations can be issued, and so we can find some solutions for schools like Link. Again, this is a loan program, and it'll be self-sustaining in the future. That's for my testimony, and we stand ready to partner with the legislature. Thank you.
Thank you. Thank you. The next 3 up, and if Office of Legislative Services, if you could turn them from participants to panelists when we call them, that'd be great. Robert Mitchell, Diocese of Patterson, Joseph Diskin, Diocese of Metuchen, and Erica Kerba, Community Health Law Project. I know all our folks from the diocese, from our archdiocese, is looking to go from the 120 to the 150 for nursing, so we hear you guys loud and clear. Robert Mitchell?
Yes, thank you so much, Senator Sarlo and members of the Senate Budget Committee. I will keep this relatively short, as you've just heard from my colleagues, Mary McElroy and George Corwell. Again, and reiterating what you just said, we are looking to secure that $150 per pupil allocation, which is so very necessary. And I'll just give you a couple of examples, some firsthand. Nurse there should be a school nurse full-time in every single building in the state. That is my belief. And especially with what is going on in the world today. If we read the paper, just some incidents happening in and around our area, just kind of corroborate what I just said. On a personal level, as a school principal, I was a public school administrator and teacher for over 38 years. And I never was without a school nurse in our building. In some instances, we had 2 school nurses in the building. That is not the case at all in many of our Catholic schools. We have some schools that only have a part-time nurse, and that could be 1 day a week, and that's just based on this per pupil allocation. With this budget increase going to $150, we are hoping that that will allow for additional nurses to be provided, hoping the increase in possibly salary could draw them to our schools. We understand that nursing shortages across the board, public and both private. Just as a point of emphasis, I just want you to realize that medications, many of our students, as you know, take medications. Could be for asthma, could be for allergies, could be for various other, maybe more serious situations. The only people allowed to administer those medications in the school are a school nurse, a physician, or the parents. I personally was involved when I was a principal in a Catholic school where one of our students had an asthma attack. There was no nurse on duty. The parent worked in New York City. It was virtually impossible to get here in the adequate time needed. We needed to call 911, call the ambulance, bring that student to the hospital. Certainly, that was the right thing to do, but it certainly impacted our public fire department, 911 emergency, and the EMTs that were there. If we had the nurse in the building, that certainly would not have happened. Again, we hope that you can see your way through to getting this budget raised from the current 130 to the 150. I thank you for your time.
Thank you. Okay. Joseph Diskin.
Good morning, Chairman Sarlo and members of the Senate Budget and Appropriations Committee. I appreciate you having me here today. Again, just what Mary, George, and Bob communicated to everybody, I'm here to urge you to fully support and prioritize the funding of New Jersey's non-public schools, particularly our Catholic schools, and to ensure the provision of full-time qualified nurses in every school. One of the most urgent needs in our non-public schools is that provision of a full-time certified nurse. The health and safety of all our students, whether in public or non-public schools, must be a shared priority. Students in Catholic and other non-public schools experience the same health conditions, medical emergencies, and mental health concerns as those in public schools. They deserve the same level of care and attention. Currently, many non-public schools must rely on part-time or shared nursing services, which leaves significant gaps in coverages, such as in emergencies with allergic reactions, diabetic episode, or an unforeseen injury. Full-time nurses are also essential in managing the chronic health conditions, providing preventative care, administering medication, and addressing those growing mental and emotional health needs of our students. By investing in full-time nurses for non-public schools, the state will be ensuring equity in health services, supporting families, peace of mind, and protecting the well-being of children. Similar to Bob, I was in the public schools for over 35 years. We always had nurses full-time. I had to cover one of our schools for 3 months in the fall. And I knew it, but when you're there, it kind of shocks and surprises you that they only had a nurse on Monday mornings and Thursday and Friday afternoons. So if anything does happen in an emergency nature, of course, our first call is to 911. So I really appreciate the time and you taking this into consideration, and have a great day today. And thank you for all you do.
Thank you, sir. Rika?
Yes.
Kerber.
Good morning, Chair Sarlo and distinguished members of the committee. My name is Erica Kerber, and I'm the Executive Director at the Community Health Law Project. We are a statewide nonprofit legal services organization that provides legal services to low-income individuals with disabilities, chronic health conditions, and the frail elderly. Since 1978, we have received funding from the Department of Human Services, Division of Developmental Disabilities, or DDD, to provide legal services to individuals with intellectual and developmental disabilities. Unfortunately, after 47 years, we have been informed by DDD leadership that the proposed budget for fiscal year 26 does not include our DDD grant of $350,000, although DDD advised that they did not recommend this cut. With this annual $350,000 grant, we have served over 200 individuals with intellectual and developmental disabilities per year in a variety of legal issues involving housing stability, income security, healthcare access, domestic violence, guardianships, and more. The demand for our services always exceeds our ability to assist all of the families who seek our help, and every year we keep a running waiting list of families seeking our assistance. Without this funding, an entire vulnerable population will not receive the essential legal assistance they will need to continue living independently in the community and could potentially be at risk of institutionalization. To illustrate the devastating effect of this funding cut, I'd like to share examples of 2 cases we've handled. We assisted a client who is developmentally disabled with numerous health conditions. This young man lives in his family's home with the help of private duty nursing services 16 hours per day, 7 days per week to address his medical conditions. His Medicaid managed care organization sent him a notice stating that they would be significantly reducing his nursing hours. However, with reduced nursing hours, this client would not be able to remain at home and he would need to be placed in a nursing facility. We represented him in court and were successful in restoring his full nursing hours to the original amount and preventing his institutionalization. In another matter, we assisted a client who was facing eviction for disorderly conduct in his building. We represented him in court, and we were able to negotiate a settlement whereby he would not get evicted as long as he obtained treatment and stabilization services, which we facilitated. He then remained on housing probation with his landlord for several months. At the expiration of the settlement agreement's probationary period and conclusion of a successful treatment program, this client was stable and his housing had been saved. These case examples are just two of so many more that my office has handled for this very vulnerable population to help them continue to live independently in the community. We therefore urge the committee to recommend restoration of this critical funding of $350,000 in the fiscal year 26 budget. This continued investment pales in comparison to the potentially millions of dollars that would be needed to place many of these individuals into nursing homes or other facilities, which would be likely if this vital funding is eliminated. Thank you for your time and consideration.
Thank you. Wells Winiger, Ramya Swamy, Brett Bonfield, Mary Bohan.
Thank you, Senator Sarlo. Vice Chair Greenstein, members of the Senate Budget Committee. Thank you for the opportunity to testify this morning. My name is Wells Winiger. I serve as the Executive Director of the New Jersey Policy Institute. It's a research and policy organization committed to advancing practical solutions that improve educational opportunities and outcomes for students across the state. Today, I'm here to urge the committee to prioritize the expansion of the New Jersey's Interdistrict School Choice Program that allows public school students to attend public schools in other districts that better meet their educational needs. This program provides students and parents greater access to high-quality educational options, whether through strong academic programs, specialized courses, or simply a better learning environment. Since its launch in 2001, the Interdistrict School Choice Program has grown to include 119 choice districts serving approximately 5,000 students. However, nearly 2,000 students remain on the waiting list due to state-imposed caps, despite high demand. The impact of these limitations is felt across the state. For example, Englewood Regional currently serves 265 choice students, but has 96 students on the wait list. Haddon Heights accommodates 68 choice students, but has 84 students on the waiting for an open spot. Pittsgrove serves 195 students and would like to expand to 275, but has 86 students currently on the wait list. These numbers reflect only a fraction of the unmet demand statewide. Many districts want to expand the program to serve more students, but without state action, they're forced to turn families away who are actively seeking better educational outcomes. Importantly, this program does not financially harm local sending districts. Sending districts retain their local property tax levies, ensuring fiscal stability, while students gain access to better educational opportunities. At the same time, choice districts benefit from additional state funding, which allows them to expand programming and improve educational offerings for all of their students. NJPI conducted a fiscal study to assess the cost implications of maintaining the current program versus expanding it to clear the wait list. Keeping the Interdistrict School Choice Program at its current level costs about $63 million annually. However, after accounting for savings from state aid adjustments, the net cost is approximately $40 million. Expanding the program to accommodate all students on the wait list would require a net cost of approximately $12 million using the same calculations. We'll provide this fiscal study to the members in the coming days so you can have access to our full methodology and findings. In addition to our fiscal analysis, NJPI is actively exploring ways that the Interdistrict School Choice Program could be expanded in a budget neutral manner in the future. This includes evaluating policy and funding mechanisms that allow programs to grow without increasing overall state expenditures. One promising avenue is expanding the program to Essex and Middlesex counties where there are currently no participating choice districts. These counties are home to many students who could greatly benefit from additional public school options. An initial analysis suggests that well-structured expansion combined with its targeted state policy changes could be accomplished without additional budget impact. And JPI will continue to develop these proposals and share our findings with the legislature. Beyond the immediate benefits, expanding school choice is a proactive common sense step as New Jersey faces broader education challenges. The Latino Action Network lawsuit underscores the growing concern about educational access and equity in our state. Rather than waiting for the court to rule to force these changes, the legislature has an opportunity to act now, empowering all families with more choice and ensuring stronger public education system for all. Thank you very much.
Thank you. Thank you for your testimony. Ramya Swamy?
Can everyone hear me?
Yes, we can hear you.
Great. Good morning, Chair Sarlo and distinguished members of the committee. My name is Ramya Swamy, and I'm Policy Counsel at the Brady Campaign to Prevent Gun Violence. I'm speaking today on behalf of Brady, the Giffords Law Center, and Everytown for Gun Safety. Thank you for the opportunity to provide feedback on the proposed budget for the fiscal year of 26. Gun violence remains one of the most urgent public health crises in the United States, killing more than 40,000 people each year. In light of this fact, I'm here today to kindly ask this committee to preserve funding for the New Jersey Gun Violence Research Center, the GVRC, which is a first of its kind institution at the Rutgers School of Public Health. As currently written, the proposed budget for fiscal year 26 proposes a $1 million funding cut, which is 33% of the GVRC's current budget. This cut will have a devastating impact on the center's ability to produce studies, publications, new areas of scholarship, and training of new generations of scholars, and especially the small grants program run by the center that funds gun violence research specific to the state of New Jersey. Since its inception, the GVRC has not only conducted vital research, but has also acted as a funding agency that attracts top talent to this vital area of study. This dual role enables the GVRC to drive innovation, foster collaboration, and keep New Jersey at the forefront of gun violence prevention. In the last 3 years, the GVRC has produced numerous studies with life-saving impact, including studies on exposure to gun violence and suicide risk factors, firearm safety and suicide prevention amongst military service members, secure and unsecure firearm storage, and the relationship between licensed firearms dealers and homicides in New Jersey neighborhoods that are disproportionately impacted by gun violence. For decades, federal support for gun violence research has been stymied by political opposition from the gun lobby. The 1996 Dickey Amendment effectively eliminated federal funding for such research by barring agencies like the CDC from using funds to, quote, promote gun control, creating a decades-long chilling effect that left researchers unable to gather the data necessary and to inform evidence-based policies on gun violence prevention. The Trump administration has demonstrated a commitment to exacerbating this issue by actively taking steps to ensure that projects designed to study firearm violence will not get funded. Further, Congress has cut federal gun violence research from most of its recent proposed budgets. In this environment, the GVRC's work is more important than ever. In 2024, New Jersey saw a 20% decline in gunshot fatalities, a direct result of the state's historic actions. Cuts to the GVRC's budget will stymie this incredible progress by limiting the state's ability to respond to crucial public health needs with evidence-based support and investment in public programs that will decrease gun violence in underprivileged communities, ensure New Jersey children are safe in the home at school, and provide resources for people who are experiencing mental health crises and may be at risk of harming themselves or another with a firearm. For these reasons, I respectfully urge this legislature to preserve the GVRC's budget and in doing so ensure that New Jersey remains a national beacon of progress and innovation in the fight against gun violence. Thank you.
Thank you. Thank you for your advocacy. Brett Bonfield, New Jersey Library, followed by Mary Bohan, then Vera Sanson. Brett Bonfield, New Jersey Library.
Good morning.
Good morning, Brett.
My name is Brett Bonfield. I'm the Executive Director of the New Jersey Library Association, and I'm here to speak on behalf of New Jersey's libraries. My thanks to the chair and members of the committee for listening to our testimony. We appreciate your belief in reading, literacy, and libraries, and your support for the New Jersey State Library. I'm actually in the State Library right now in one of their meeting rooms, and I have to say New Jersey is incredibly fortunate to have such a great state library. New Jersey Library Association itself actually represents New Jersey's 298 public libraries. We advocate for the 3.8 million people with library cards who benefit from New Jersey's public libraries. And we also represent New Jersey's academic libraries and the students, faculty, and staff at these institutions who benefit from outstanding collections and the library staff's expert contributions to education and research. Libraries have evolved over the years. We are invaluable social services, we are centers for workforce development, and we are one of the primary resources for older adults. Libraries are conveners. We strive to respect everyone's voice, needs, and interests, and we gather data so that we can benchmark our services, ensuring that we are learning from each other and identifying best practices. We're deeply concerned about unstable federal funding for libraries. Federal funds help pay for the data collection that we use to improve our services. It helps to pay for statewide services for people who are blind or encounter other physical challenges in reading print-based books. Federal funds help pay for web hosting and other digital services. Federal funds help pay for statewide access to databases and other research tools, as well as ebooks and audiobooks. Adequate funding ensures that libraries can continue to serve everyone who relies on library resources. With federal funding in question, we need the state to help ensure continuity of funding for New Jersey's libraries. We appreciate the support you have shown us when we have come to you in the past. Libraries support everyone in our state. Your support makes it possible for us to do our work. Again, thank you for your time, and I'm here to answer any questions as they relate to public or academic libraries.
Thank you. Thank you for your advocacy, sir. Mary Catherine Bohan, Rutgers University Behavioral Healthcare.
Good morning. Chairman Sarlo, members of the committee, thank you for the opportunity to testify today on behalf of Rutgers University Behavioral Healthcare, or UBHC. To continue our essential work, Rutgers UBHC requires sustained state investment. As such, we appreciate the governor's proposed $2.4 million line item for certified community behavioral health clinics, also known as CCBHCs. And we respectfully request that this 2026 budget line item be included in the final proposed budget. This will ensure that the CCBHC demonstration organizations can continue to sustain life-saving services, retain qualified staff, and address the mental health and substance use crisis in New Jersey. Rutgers UBHC is dedicated to a mission of excellence that includes the delivery of evidence-based and compassionate behavioral health and addiction services to individuals and families across New Jersey, advancing the science through programmatic research and educating the next generation of healthcare professionals. As a CCBHC, Rutgers UBHC provides a wide range of services designed to meet the diverse needs of our community, including but not limited to 24/7 crisis services, outpatient mental health and substance use disorder services, primary care screening and monitoring, peer and family support, targeted case management, and services for veterans and active duty military. Since becoming a CCBHC, Rutgers UBHC has achieved significant milestones. We have extended our services to an additional 6,000 individuals, families across New Jersey in the past year alone. While primarily located in Middlesex County, our CCBHC has touched the lives of individuals residing in each of the 21 counties in New Jersey. Through innovation, we have reduced the wait time to initial intake assessments and to initial psychiatric evaluation. Our organization has created numerous jobs, including positions for psychiatrists, clinicians, advanced practice nurses, case managers, and peer support specialists. Since the inception of the CCBHC demonstration project, UBHC has increased clinic staffing by 50%. By combining primary care screening and behavioral health care, we have improved overall health outcomes for our clients, and our proactive crisis services have led to a reduction in hospital admissions, alleviating the burden on an emergency healthcare system. The governor's proposed $2.4 million line item for CCBHCs will go to support sustained expansion through the state plan amendment, increased Medicaid reimbursement rates, administrative relief, and workforce incentives. Rutgers UBHC and the other demonstration providers are transforming the way mental health and substance use care is delivered in our state. With continued investment and policy support, we can ensure that more individuals and families receive timely, effective, and life-changing care. Thank you for your time and consideration. We welcome any questions. We look forward to working together.
Thank you, Mary. Vera Sansone, representing Child Psychiatric Center of Integrated Health.
Hi. Good morning, Chairman Sarlo and the members of the committee. I want to thank you for the opportunity to testify on behalf of CPC Integrated Health to continue the life-saving work we have been grateful to provide, in large part due to the state's continued investment in our efforts. As such, we appreciate the governor's proposed $2.4 million line item for CCBHCs, and we respectfully request that this 2026 budget line item be included in the final proposed budget. This will ensure that the CCBHC demonstration organizations can continue to provide these essential services, retain qualified staff, and address the mental health and substance use crisis in New Jersey. CPC was established in 1960 due to the efforts of a group of family members who could not find local care for their children and had to travel to New York or Philadelphia for the specialized services they needed. Children's Psychiatric Center, now CPC, was formed through their efforts and has grown into the largest nonprofit integrated care provider in Monmouth and Northern Ocean counties. To this day, our mission is to support those in the community with complex disorders and to provide a safety net for the underserved and the underinsured, and that has not changed. Nor has our desire to respond to the changing needs of our community, just like that group of parents did back in 1960. CPC is proud and grateful that over 12,000 individuals trust us to support them in their recovery journey each year. In 2017, we were proud to become one of the 7 agencies in New Jersey that became Certified Community Behavioral Health Clinics, otherwise known as CCBHC. This SAMHSA Innovation Pilot Program has been a game changer and has allowed us to remove barriers for people who need care to get it when they need it, where they need it, and how they need it in a one-stop approach with quality outcomes and evidence-based treatment as cornerstones of the model. CCBHC requires the traditional services that most behavioral organizations provide, but also mandates services like case management, which can help folks with issues anywhere from housing to food insecurity to legal issues, and 24/7 crisis services that ensure that people can live productive lives in the community by reducing the need for unnecessary and costly higher levels of care, such as ER visits, police involvement, or long-term hospital stays. It also allows CCBHCs to expand staffing and to recruit staff who have specialized skills with the populations that we focus on, which include criminal justice involved clients, children and families, veterans, people with significant mental health and substance use disorders, and those with chronic medical challenges. No longer do people in our communities have to wait long periods to address their complex needs. CCBHC does it all and does it well, as there are also quality measures that we must meet in order to maintain our certification. CPC Integrated Health, along with the 6 other CCBHC providers in New Jersey, are transforming the way that services are delivered in New Jersey and also across the country. CCBHC ensures that the underserved and the underinsured can receive quality and often life-saving services. Again, we thank you for including the $2.4 million in the line item in the proposed budget, and we urge you to ensure that it is in the final proposed budget plan as well. Thank you for your time and consideration. We look forward to working together to strengthen the behavioral health safety net for the citizens of New Jersey.
Thank you. Jackie Burke, followed by Sharon Kringle, followed by Randall Solomon, followed by Megan Glazer.
Senator Sarlo, members of the Senate Senate Budget Committee. I'm so used to talking in front of the Education Committee. Thank you for the opportunity to testify. My name is Jackie Burke, and I'm the Executive Director of the Council of County Vocational and Technical Schools. As you begin your deliberations, I would like to start by expressing our sincere gratitude for the support this committee and the entire legislature has given to our district in career and technical education. As you know, demand for our districts continues to grow, both from career-minded students and employers seeking technically trained employees. Unfortunately, this demand far exceeds the capacity in our district. In 2018, the legislature, along with the voters of New Jersey, approved the Securing Our Children's Future Bond Act, which included $275 million for construction projects in our district to increase capacity. To date, 18 of our districts have been approved to build and expand their footprint, enabling them to serve an additional 4,700 students, in high-demand careers when they are fully enrolled. However, supporting the cost of educating these additional students is a challenge for 7 of our districts that have not received an increase in state aid since 2018 and are not likely to see an increase under SFRA due to their county wealth determination. These include Bergen Tech and Cape May Tech. Because our districts are not able to levy taxes, they are entirely reliant on funding from the state, their county, and local school district support through tuition. Without an increase in state or county aid, local school district contribution is the only way to make up for any deficit, which can affect property taxpayers in the sending district. To ensure this does not happen as our schools expand, we are requesting a small amount of additional per pupil funding to be provided to cover the cost of the increase in enrollment in those districts that have not received an increase since 2018. This amount would be based on the calculation of additional funding needed to educate a county vocational technical school student as determined by the Educational Adequacy Report. This is roughly $4,000 per student. Fully enrolling the new spaces will take approximately 4 years as an additional cohort is added every year. During those 4 years, our calculations indicate this would cost an additional $1.3 to $2.5 million to the budget each year for a total cost after 4 years of just over $7 million. Because many of our schools will be opening their new or expanded schools this September, it is imperative that this provision be included in this year's budget. The mechanism is already included in Senator Gopal's school funding formula revision bill, where we hope the additional aid will become permanent, but we're not sure how quickly that bill is going to move. Thank you for your consideration, and I'm happy to answer any questions.
Thank you, Jackie. It's good to see you again. Sharon Kringle, please.
Good morning, all. Thank you, Chair Sarlo and members of the Senate Budget Committee for the opportunity to testify about Education Law Center's analysis of school funding in Governor Murphy's proposed FY26 state budget. I am Sharon Kringle. I am the Director of Policy, Strategic Partnerships, and Communications at ELC, and ELC strongly supports the governor's proposal to increase K-12 public school funding by over $400 million compared to FY25. while also continuing to fund preschool expansion with an additional $10 million, and we urge the legislature to support all of this as well. The FY26 budget implements necessary updates to the School Funding Reform Act through the Educational Adequacy Report, which was submitted by the administration as required by the SFRA law. This year's adequacy report proposes significant changes, such as increases to the base costs to account for student mental health, updated special education per pupil costs, and updated security resources. This year, the administration also listened to school district leaders and advocates, including ELC, and made some significant changes in school funding through budget language. Of those we strongly support, the proposed caps that limit the annual state aid reduction to no more than 3% of a school district's state aid, providing special education funding based on the actual count of students with disabilities instead of the statewide average, and averaging 3 years of property and income data for the local fair share calculation instead of using a single year. But we do have several suggestions to improve school funding in the coming year's budget. The proposed budget doesn't include any property tax relief for school districts that are raising less than their local fair share. The property tax cap prevents the vast majority of below adequacy districts from raising the additional revenue needed to meet their local fair share as determined by the SFRA. Also, special education funding remains a challenge for school districts across the state. I know you've heard this previously, but the governor's proposed budget includes no increase in extraordinary aid that reimburses school districts for high-cost special education placements. The funding available last year only covered about 62% of districts' eligible costs, and expenses keep increasing, and with no increase in funding, this will push districts even further behind. The governor's proposal also includes no new money for major capital construction, with only a small amount of funding to cover emergent projects and capital maintenance needs statewide. And this is even though tremendous need remains in the SDA districts, which I know you will hear soon from SDA. And finally, even with the recently released Educational Adequacy Report, the formula is still in need of a more thorough and in-depth analysis conducted in partnership with school finance experts, school district leaders, parents, students, and other stakeholders. So I thank you very much for this opportunity, and I'm happy to answer any questions if there are any.
Thank you so much. Randall Solomon, followed by Megan Glazer, followed by Rosie Taravella. Randall Solomon?
Great. Hello, good morning,
Good morning,
and
how are
thank you. My name's Randy Solomon. I'm the Director of Sustainable Jersey, which is run out of the College of New Jersey. Municipalities and schools are a critical part of New Jersey's ability to govern. Tremendous responsibility is placed on local government, and it's expanding. Examples include legislative and regulatory action, including new mandated climate change vulnerability assessment requirements for master plans, MS4 permits, green infrastructure rules, stormwater utilities, climate education standards in schools, property assessed clean energy or CPACE, to name just a few. Obviously, taxpayers expect government to work. Municipalities and schools have major authority and duties, but they often don't have the capacity to match. The Sustainable New Jersey Fund was created as a non-lapsing, stable source of funding to support local governments and to enable the legislature to marshal the power of local governments to achieve statewide goals. The fund supports the work of Sustainable Jersey, which is administered by the College of New Jersey, which is an instrumentality of the state. The structure was created by state agencies in partnership with the New Jersey League of Municipalities and the New Jersey School Boards Association to be a missing link between local and state government. We have the nimbleness of a nonprofit with some of the institutional capacity of state government. 91% of people in New Jersey live in a participating community in every county and every type of community, large to small, urban to rural, rich and poor, Republican and Democrat. We have an outsized impact relative to our budget request. 3 key points on what we do. We expand local capacity. We're the state's leading assistance provider to municipalities and schools on dozens of issues such as energy efficiency, renewable energy generation, preparation for climate change, building walkable communities, waste and recycling, and many, many more. It's not reasonable to expect the average mayor or business administrator to be experts on each of these issues, and uncertainty means inaction. We save money. Energy efficiency upgrades in schools result in an average of $100,000 saved per district per year. School districts can save $400,000 annually through our food waste reduction program. We've helped dozens of municipalities and schools to not lose out on federal and state grants, and we help secure no-cost and low-cost solutions, bringing in external funds and resources to speed implementation. And finally, we make government work. We're a nimble problem solver. We identify the roadblocks in these programs and many state programs, and they're nobody's job to fix them, so we fix them. We've developed new tools that were critical elements for purchase of electric vehicles, implementing clean energy upgrades for government facilities, helping the community solar program succeed, dozens of model plans and templates, and model RFPs that help local governments not get ripped off.
Thank you.
Thank you so much.
Thank you, Randall. Just a quick update for everybody. All the members that are on, I'm sure they would love to ask a lot of questions, but this is our opportunity to sit and listen. So, if we weren't allowed to ask a lot of questions, we would be here well into the evening. So they are paying attention, and their staffs will be getting copies. Just again, and once you testify, you could stay on and listen, but please feel free to leave the panel. Megan Glaser, Leading Age New Jersey, followed by Rosie Taravella.
Good morning, Chairman Sarlo. My name is Megan Glaser, and I'm the Vice President of Leading Age New Jersey and Delaware. Thank you for the opportunity to speak with you today on behalf of our association, which represents over 150 mission-driven aging services providers. We represent the full continuum of care. So nursing homes, assisted living residences, home and community-based services like PACE, hospice, assisted living programs, as well as independent senior affordable housing. Our members continue to work extremely hard caring for older adults while dealing with ever-changing regulations and severe staffing shortages. Many of the organizations which I'm proud to represent have made it their mission for more than 100 years to take care of the frail and elderly in our state. And I know that when I may need long-term care one day, I want to make sure that they still exist in New Jersey. The number one priority of our members is making sure they have the staff and resources to provide quality care for older adults. While we appreciate the support of both the legislature and the administration and what they've provided to the sector the last few years, the truth is that reimbursement rates just haven't kept up with the cost of providing services. And our association has serious concerns about the future of long-term care in New Jersey. LANJDE is grateful that the governor's proposed budget allocates $7.2 million for nursing home staff wage increases, and we're encouraged that the Department of Human Services is in the process of implementing a cost report-based rate setting system, which is recognizing the outdated reimbursements, which haven't been rebased in more than a decade. However, the potential federal Medicaid cuts on the chopping block, which you heard my colleague from HCA&J mention earlier, it would be catastrophic for the frail and elderly in New Jersey. So it's important to note that the nursing home funding proposed in the SFY26 budget doesn't come close to the shortfall between the costs of quality care and current Medicaid rates. While the governor's proposed budget has supported home and community-based services, it has not provided an across-the-board rate increase for assisted living in 2 years, which is a vital home and community-based service by definition. This year, in support of our assisted living providers, which all help save the state money and keep people out of higher cost of care settings like nursing homes, we ask that a small portion of the funding already included in the governor's proposed budget for home and community-based services be allocated to increase the Medicaid reimbursement rates for assisted living providers, which would be $5.5 million to the state of New Jersey. This investment would help older adults age in place. I submitted written testimony to you, Chairman, and members of the committee, so I know I'm at time, but we also need to increase senior affordable housing. So I thank you for your time today and all you do.
Thank you, Megan. Rosie Taravello, followed by Mary Ellen Peppard, followed by Raquel Henry.
Thank you, and good morning, Chairman Sarlo, Vice Chair Greenstein, and members of the Senate Budget and Appropriations Committee. I am Rosie Taravella, the Regional Executive for the American Red Cross of New Jersey. I'm sure you're all familiar with Red Cross and the services we provide. Some committee members have seen the work we do firsthand by providing us with organized blood drives in the community or while we respond to a flood or home fire in their districts. While many services that we offer are appreciated, there are 2 areas that are the most common and the most costly. We're grateful for the financial support we have received from the state of New Jersey for the past 4 years, and a special thank you to Senator Zwicker for being our previous budget resolution prime sponsor. Most recently, the legislature restored most of the FY24 funding that had been reduced in the original FY25 budget. Unfortunately, this year, our state assistance was not just reduced, but was completely removed from the proposed budget. We respectfully ask the legislator to restore our funding to $1.5 million, the amount that was appropriated in FY25. We recognize that this budget year is difficult, and as you consider the many requests for state aid, we ask that you also consider the residents across the state that have benefited from and would continue to benefit from this assistance. The funds we received in FY25 have been pivotal in our disaster assistance and blood collections operations, and we would plan to use FY26 funding for those same needs. We assist about 1,000 families annually who have been displaced as a result of a home fire, flooding, or other disasters by providing them with financial assistance for immediate needs such as food, shelter, and clothing. Typically, this service costs us over $1.6 million a year, and this figure continues to increase due to inflation and the rising number of disasters. As of last month, we had already exceeded $1.2 million, which puts us on a path to spending more than $1.7 million this fiscal year. We also conduct more than 2,000 blood drives a year, collecting about 77,000 units from New Jersey donors, assisting our area hospitals in helping victims of trauma, cancer patients, women giving birth, sickle cell patients, and others. The average cost to host each event, which includes collection, testing, processing, and distribution of blood components, has increased from an average of $3,900 to $5,000 over the past couple of years. Fixed donor sites are also necessary to meet the demand for platelets and other special blood products. Platelets can only be donated at fixed sites because of the specialty collection staff and equipment involved, and we're very grateful that state funding has helped facilitate the opening of 2 new locations, easing the burden on would-be donors by finding them in their local areas and ensuring the timely delivery of life-saving blood and blood products. We very, very much appreciate the state funding we have received in the past and hope we can count on the legislature's support once again so we can continue to support victims of house fires and weather disasters and improve our state's critical blood supply.
Thank you,
Thank you
Rosie.
for your consideration.
Thank you. Mary Ellen Pepper, New Jersey Food Council, followed by Raquel Henry. Mary Ellen?
Good morning, Chairman, members of the committee. Thanks very much for the opportunity to be here today. It's great to see everyone. I do want to note that we appreciate that the proposed budget includes the money for SNAP and WIC and other food security programs, including maintaining the $95 minimum SNAP benefit. We do have some concerns about some of the tax increases in the budget proposal. We do recognize, of course, it's a difficult fiscal year. I don't want to go into great detail because I know you've already heard about some of these tax increases, but the warehouse truck tax, the $2 tax on warehouses based on the number of truck trips. Of course, it's not clear how this would be implemented, and this would actually be meaningful for our members. Some of them have thousands of deliveries per week. Of course, this raises the cost of transporting food and other necessities. We do have concerns as well with the tobacco tax increases. The cigarette tax, consumers may respond by purchasing these products in other states or on the black market. We do tend to see an increase in smuggling and illegal activities when the tobacco excise taxes are increased. This is something that our members have talked about for many years now. And this also has an impact on youth. Fortunately, youth cigarette smoking is significantly down, but excessive taxes tend to undermine this progress by shifting these purchases to the illegal, unregulated markets. Of course, when you look at the food retailers, convenience stores, one of the big concerns we have is the loss of ancillary sales for the customers who would have previously gone to that store for their other products prior to a tax increase. It's particularly an issue when we look at the border areas, the border counties. At the moment, Pennsylvania is just 10%, 10 cents per pack below New Jersey. If we raise that gap to 40, this could be enough to shift those purchases across those state lines. We also have some concerns with the alcohol beverage tax increase. What we're really hearing a lot about right now is the uncertainty regarding the tariffs. And you look at the cost of aluminum, you look at the agricultural inputs in making these products. So that's something that's just been really concerning. And then we also do have some concerns with the realty transfer fee, the assessment proposal, and the impact on commercial markets. I know I'm just about at time. I did provide some written testimony, and I look forward to working with you all very much this season. So thank you.
There's a lot of uncertainty out there for a lot of your purveyors, so we'll pay attention. Raquel Roman Henry, Salvation and Social Justice, followed by Julie Galante, followed by Kate Kelly.
Thank you. Good morning, Chairman Sarlo and esteemed members of the committee. My name is Raquel Romans Henry, and I have the honor to serve as the Policy Director for Salvation and Social Justice. We are a Black-led, nonpartisan social justice organization based out of Trenton, and thank you for the opportunity to submit testimony today. While we acknowledge that this is a difficult fiscal year, we also recognize that regrettably, New Jersey continues to lead the nation with some of the highest racial disparities. These budgetary requests that we're making, we believe, are critical to really redressing these disparities and advancing equity, justice, and fairness in the state. So I'll run through them really quickly, and I'm submitting something in writing as well. First, we'd like to applaud Governor Murphy for his promise to commit $25.5 million of cannabis revenue towards supporting hospital-based and community-based violence intervention programs. We know that a significant part of maintaining the safety of Black communities in the state involves really limiting the interaction between law enforcement and those communities. And models such as the CBVI programs that we have proven to be both effective and preventative mechanisms by which residents are kept safe and are not siphoned through the carceral system. We know that Black residents are 3 times more likely to face police use of force than white residents and 3 times more likely to be fatally shot by the police. So we are calling to have the funding that's currently being allocated to CBVI work to be doubled in order to increase the capacity of the CBVI organizations that are currently doing this incredibly sacred work. Additionally, we want to ensure that those programs receive the state grants that receive these state grants be allowed to charge 10% indirect costs, allowing them to cover essential operational expenses such as rent, utilities, and other administrative costs that may not fall directly under specific programming. Additionally, we are respectfully requesting that all of these programs be funded by that were previously funded by federal funds be solely funded by cannabis revenue. We know that with the instability of the federal government right now, many of these programs are very vulnerable. So it's important that the state really step up and provide the necessary funding to continue this work. Then I want to move on really quickly to Black maternal health. We know that while there have been improvements in New Jersey around maternal mortality rates, what we are seeing is that those improvements are not making its way to Black women and our communities. Black women are still 7 times more likely than white women to die during childbirth. Black babies 3 times less likely to see their first birthday. Research shows that in New Jersey, 80% of the maternal deaths are actually preventable. And in New Jersey, Black women are 20% more likely than white women to receive C-sections. That's in instances where those women have the same medical history, same doctors, and are delivering in the same hospital. So what we know is that there needs to be more investments in community-led grassroots models to address this. So we are requesting a $20 million investment to support grassroots organizations in this work, as well as $12 million to support the targeted workforce development of Black midwives. And additionally, real quick, we are asking that we increase funding or re-up the funding for restorative justice hubs. And thank you for your time. I'll be submitting something in writing in more detail.
Thank you so much. Julie Galante, followed by Kate Kelly, followed by Liz DeCourcy. Is Julie on? Jersey YMCA State Alliance, Julie? Okay, we'll come back to Julie then, and we're going to go to Kate Kelly.
Thank you for your time. Senator Sarlo and members of the committee, as Executive Director of the Supportive Housing Association of New Jersey, I'm here on behalf of our Board of Trustees and members of the Supportive Housing Association of New Jersey. Our association represents 110 member organizations, all dedicated to the creation of permanent, affordable housing with flexible supportive services for people with disabilities and other special needs. I am very happy today to see that so many of our members have also been here this morning to testify on behalf of their organizations. As you probably all know, individuals may live with one or more challenges such as mental health, physical, intellectual, or developmental disabilities, recovery, aging, or those experiencing or exiting homelessness. But what they all have in common is a need for safe, decent housing and supportive services. Robust investments in capital funding are necessary to continue to build on this proven strategy of supportive housing that works here in New Jersey. It's also critical that we have operating support in the form of rental assistance and service dollars that will allow people with special needs who are currently waiting for housing to finally find a home. I will submit my more extensive written testimony that goes into detail, but we do at SHA have some suggested 2026 budget and policy priorities. Regarding capital, we are very grateful for the legislature's support of last year's landmark affordable housing legislation here in New Jersey. This critical legislation ensures that people with disabilities can find a home they can afford in communities throughout the state for years to come. Towns are just beginning to fulfill their Round 4 obligations under Mount Laurel, which are expected to result in the production of 84,698 new affordable homes. Future capital investment continues to be needed to support a robust pipeline of affordable homes. We are deeply concerned that the governor's budget proposal diverts most, if not all, of New Jersey's Affordable Housing Trust Fund for over 80% area median income projects. This fund is explicitly intended for under 80% AMI housing efforts. Now is not the time to drain the Affordable Housing Trust Fund for other purposes outside of producing affordable homes. The FY 2026 budget must plan for and grow housing production resources. The Affordable Housing Trust Fund is a major dedicated source of affordable homes for individuals with special needs. We are thankful that the legislature and governor adopted legislation in 2021 to fund the Special Needs Housing Trust Fund and dedicated $20 million in realty transfers. This funding should be transferred from NJHMFA for the Special Needs Housing Trust Fund as a dedicated revenue source before the fiscal year turns over and the collections are deposited within the trust fund. Thank you for your time.
Thank you so much. Liz DeCourcy. Liz? Hi, Liz. I see you.
Yeah, hold on.
Greater Middlesex and Morris Habitat for Humanity.
Yes,
Thank you.
thank you. Good morning, Mr. Chair and members of the committee. Let me first thank you for your service and commitment. I understand that you have difficult decisions to make. I'm Liz DeCourcy, the CEO of Greater Middlesex and Morris Habitat for Humanity, and our nonprofit for the past 40 years has been dedicated to building homes for low and moderate income families. To date, we have received over $4.5 million from the Affordable Housing Trust Fund to build 26 homes. While that is a tremendous achievement, I'm here today to share with this committee the homes that will not be built if the proposed budget diverts the money from the trust fund, and to urge this committee to save the trust fund, often the only source of funding for smaller projects like ours. We have been partnering with municipalities for more than 20 years to build affordable for-sale homes, developing a pipeline of over 350 new units, but these homes are now in jeopardy if the trust fund goes away. We are actively working with dozens of municipalities in Middlesex and Morris counties. These 100% affordable projects significantly reduce the impact to a town's infrastructure. Robust state level funding for housing is particularly crucial this year as towns work to meet their round 4 requirements. As New Jerseyans, we should be proud we have one of the best affordable housing systems in the U.S. I urge committee members to help us reach its full potential by saving the trust fund so we can continue to build new homes like the ones we completed for Stephanie and her young daughter. After her divorce, Stephanie was forced to move back in with her parents who were caring for her disabled grandmother. What was meant as a temporary housing solution stretched into 5 years. During that time, COVID hit and Stephanie's father suffered a stroke. Although grateful for her parents' support, there were challenges. Structure and routine, vital for a child's development, became nearly impossible. Her daughter was diagnosed with OCD and anxiety. Stephanie also suffered with stress and that was limiting her ability to move forward, and she grieved the loss of independence and the ability to raise her daughter in her own space. The high cost of housing robbed her of that freedom. Stephanie was losing hope of ever having a tranquil home of her own. That was until she was selected by our affiliate for a new 2-bedroom home. Today, Stephanie and her daughter have been in their home for a year, and her daughter has blossomed into a happy and independent second grader, spending hours outside with new friends and even enjoying sleepovers for the very first time. Her therapist is amazed at her transformation that she is striving, and Stephanie at last has found peace. When I asked her what she liked most about her new home, she replied that no one can take it away. Please help us and other New Jerseyans just like Stephanie, who cannot afford the high rents and costs of mortgages. Together with this committee's leadership, we can help our fellow New Jerseyans achieve the American dream of owning their own home right here in the great state of New Jersey. Thank you for your time.
Thank you so much, Liz. We're going to move to Scott Millard, Sarah Matthews, Connie Mercer, Dr. Powell.
Thank you, Chairman Sarlo and honorable members of the Senate Budget Committee. My name is Scott Millard, and I'm the CEO of Passaic County Habitat for Humanity, which for over 40 years has been building and repairing affordable homes for low to moderate income families. New Jersey's Affordable Housing Trust Fund is an essential source of public financing for the development of affordable housing in New Jersey strengthening neighborhoods and stimulating economic growth. I'm greatly concerned that the governor's budget proposal will divert critically needed dollars from the Affordable Housing Trust Fund to other budgetary needs. Without 100% of the resources intended by law for the Affordable Housing Trust Fund, the development of affordable homes will diminish in New Jersey. We saw this when previous administrations diverted the funds, and we will see it again if the legislature does not act to change the governor's proposed budget. Over the past 18 months, Passaic County Habitat has moved 13 families like Anna's into new affordable homes whose development was subsidized by the Affordable Housing Trust Fund. Anna became a mom at the age of 18 and had little to no support. Yet she graduated from college and landed an amazing job, which led her to learning about Passaic County Habitat for Humanity's homeownership program. As Anna has shared, as a single mother, Passaic County Habitat for Humanity has changed my entire life. Through the Habitat program, I learned basic construction skills and financial literacy and was able to purchase a home. I went from being a homeless single mother overcoming domestic violence to accomplishing a goal that millions dream of. I am a homeowner, and my children are blessed with a forever home thanks to Habitat for Humanity. New Jersey has a deficit of over 250,000 units of affordable housing due to over 20 years of underdevelopment, which the legislature recognized when it passed A4S50 last year. And the Affordable Housing Trust Fund is a crucial resource for fulfilling the mandate the legislature created with the passage of those bills. This is the time to increase our investment in the Affordable Housing Trust Fund, not divert it. The governor closed his recent budget address by stating, "Every aspect of the budget has been crafted to make our collective dreams for New Jersey a reality, meeting the sacred obligations to the people we serve and strengthening the economic security of every New Jerseyan." If the governor's planned diversion of the Affordable Housing Trust Fund is not stopped by the legislature, that statement will become a lie for the 20 families Passaic County Habitat for Humanity is planning to welcome home over the next 2 years utilizing the Affordable Housing Trust Fund. I urge you to preserve the Affordable Housing Trust Fund in its entirety for its intended purpose in the FY26 state budget, the development of desperately needed housing for low to moderate income families. Thank you for your service and your time.
Thank you, sir. Sarah Matthews.
Honorable members of the Senate Budget Committee, my name is Sarah Matthews. I'm the Executive Director of Habitat Cape May County. I'm here today to advocate for the preservation of the New Jersey Affordable Housing Trust Fund as a dedicated resource for the development of affordable housing across our state. I'd like to share with you some unique challenges of Cape May County. We have a high home vacancy rate. Over 50% of our nearly 100,000 housing units sit vacant for much of the year, primarily used as second homes or vacation rentals. This significantly limits the availability of housing for our essential workforce. We have limited land for development, with 60% of our geography surrounded by water and 12 of our 16 municipalities located along the ocean or bay. Large-scale, high-density housing solutions are impractical. Our housing solutions must align with our rural and coastal landscape. We have a shrinking workforce. The county's population is rapidly aging, with a median age of 52.7 years, which is the oldest in the state. The under 18 population has declined from 19% to 16%, while the over 65 population has grown from 22% to 31%. The high cost of housing is pushing young families and the workers that are critically needed out of the county, leading to economic contraction and municipal revenue loss. The Affordable Housing Trust Fund is often the only public financing source available for small, 100% affordable homeownership developments. The very projects that nonprofit developers like Habitat for Humanity build to support low and moderate income families. Habitat Cape May has already invested $100,000 on our most ambitious project yet, which will rely on anticipated AHTF grant revenue that will result in homeownership for 10 families. This project is the on-ramp for expanded capacity for Habitat Cape May to better meet the growing need for constituents in this area. This AHTF opportunity enhances collaboration between us, municipalities, and the state, which results in far greater impact collectively. New Jersey's own state plan calls for diverse housing options and sustainable growth policies that prevent displacement, encourage inclusionary zoning, and promote fair housing. To achieve these goals, the Affordable Housing Trust Fund must remain fully funded. While other housing initiatives also need resources, diverting AHTF dollars would undermine the production of tangible, long-term affordable housing solutions, the very foundation of economic stability for countless New Jersey families. I respectfully ask this committee to keep these dedicated funds intact and ensure they continue to serve the purpose for which they were created, to provide safe, stable, and affordable housing for those who need it most. Thank you so much for your time.
Thank you, Sarah. Connie Mercer, Executive Director, New Jersey Coalition and Homelessness, followed by Dr. Kerry Powell, followed by Laura Waddell.
Hi.
Thank you, everybody.
Hi, I'm Connie Mercer, Director of the New Jersey Coalition to End Homelessness. And I wish all of you senators, the wisdom of Solomon in making the very difficult funding decisions that you've got to face. On any given night, there are over 12,680 homeless people in our state. And the only lifeboats for them, and ultimately for all of us, are our shelters. But without emergency funding of $10 million to pay our heroic frontline staff, many of these lifeboats with life-saving services will sink below the surface. We are in the eye of a perfect storm for several reasons. Our homeless population has grown 45% over the last 2 years, 24% just last year, and is accelerating as we speak with the craziness coming from Washington. Over 158,000 heads of households were counted in the Homeless Management Information System last year. That's more individuals and families who are homeless or at risk of homelessness than the population of Paterson, our third largest city. That's crazy, guys. The largest increase in the unhoused has been families with children and people over 60. Last week, a 94-year-old man in Newark sought refuge in a homeless shelter. He could no longer pay the escalating rent at the place where he had lived for over 30 years. 94 years old. We all know that affordable housing is the ultimate answer, but as you heard from testifiers a few minutes ago, New Jersey is short 250,000 low-income units, so those permanent units aren't coming to save us anytime soon. Allowing shelters to close and instead sheltering people in jails, mental hospitals, motels, or on the street would be inhumane, ineffective, and prohibitively expensive. Keeping shelters' doors open just makes sense. Of our 144 shelters, our lifeboats in the storm, 74% report having severe trouble keeping staff. And since staffing is generally 70% of a shelter's budget, closing their doors is a looming threat or has already happened. We have lost 18% of our shelter beds in the last 4 years. The reason we can't keep shelter staff is simple. We don't pay enough. The cruel and unjust irony is that making enough to prevent them from becoming homeless themselves. They are trying to survive, so simply stated, we are losing our staff to McDonald's. There the work is less emotionally demanding and the pay sure is better. I am fully aware that New Jersey funding is finite, but I'm afraid we must view the need for shelter funding as a code red in the New Jersey emergency room. If shelters close and the homeless are unserved, they will become visible to everyone, affecting businesses, safety, health, and the overall quality of life in our state in irreversible ways. We cannot become like Los Angeles. We as a state must take care of the most vulnerable among us. $10 million for shelter staff salaries will keep these lifeboats afloat while we work towards a sustainable future. Thank you.
Thank you, Ms. Dr. Kerry Powell, New Jersey Primary Care.
Thank you, Chairman Sarlo and the members of the committee for the opportunity to testify on the Governor's fiscal year 2026 budget. I am Dr. Kerry Powell, CEO of Neighborhood Health Services Corporation and Chair of the New Jersey Primary Care Association's board. I am here today representing the 23 federally qualified health centers and their 138 sites of care, covering medically underserved areas in all 21 counties of the state. As the state's largest primary care safety net provider in 2024, our FQ8Cs served 624,678 New Jerseyans, regardless of the patient's ability to pay. Over 94% of our patients are low income, and over 80% are medically uninsured or Medicaid insured. Congress is considering $880 billion in cuts to the Medicaid program over the next 10 years. These cuts will be devastating for Medicaid patients in New Jersey and across the country. About 18.2%, or 335,420 Medicaid-covered individuals receive essential primary and preventive care services at the FQ8Cs. It is estimated that about 30% of all New Jersey FQ8C Medicaid patients, and of that 100,625 expansion adults, will lose coverage as a result of one of the cuts being considered by Congress. We all know that without Medicaid coverage, these patients will not seek primary and preventive care and will end up in the hospital emergency rooms requiring treatments and or costly hospitalizations. New Jersey's Uncompensated Care Fund, administered by the Department of Health, is a charity care reimbursement mechanism for eligible uninsured patient visits at the FQ8Cs. It is not a grant. Based on a letter of agreement, FQ8Cs receive a standard reimbursement for each eligible uninsured patient visit. Our ask is threefold. An uncompensated care fund reimbursements for uninsured visits must cover the true cost of care. The actual cost of a patient's visit in an FQ8C in 2023 is about $260. The current uninsured patient visit is reimbursed at $114 per eligible visit by the state. On average, FQ8Cs lose about $148 per patient per visit. To ensure sustainability of FQ8C operations, patients who rely on FQ8Cs for access to care, we are requesting that the current uninsured patient reimbursement rate be increased to $154, which reflects a $40 increase in the per patient visit rate. Our second, and that would be adding an additional $24 million. The second ask is Medicaid reimbursement rates cover all cost of care. We are asking that the PPS rate be increased from $24 to $34 with an additional $9.6 million. And our last ask is protecting the FQ8C with their safety net funding. This would require an additional $10 million set aside for FQ8Cs for a safety net relief for emergencies. Please support this additional funding, which is $43.6 million for health centers in the 2026 budget. Thank you for the time.
Thank you, Dr. Powell. Laura Waddell, followed by Valerie Sells, followed by Cheryl Blackwell.
Thank you. Again, my name is Laura Waddell. I'm the convener of New Jersey for Healthcare, the state's consumer health coalition. In a time where there is great uncertainty, prioritizing access and affordability are vitally important to the health and well-being of New Jersey patients and consumers. Although we know there is more work to do to build on the progress made in healthcare, we recognize the very real and detrimental federal funding cuts that are threatening health coverage, accessibility, equality, and affordability for millions in our state. We would ask the legislature to adopt a budget for fiscal year 2026 that funds the following healthcare priorities: $165 million allocated to continue the successful Cover All Kids program that enrolled nearly 90,000 already eligible and over 42,000 newly eligible children since 2021, and to devote efforts to re-enroll as many eligible children from those who've been terminated from coverage from the federal unwinding of Medicaid redeterminations. Fully fund the creation of a health coverage option for Medicaid income ineligible children so they have access to a health plan that is both comparable in cost and quality. Early estimates for this program are approximately 2,000, for this population are approximately 2,000 children. However, as a result of terminations through the unwinding of Medicaid redeterminations and other factors, that number has likely increased. Health insurance affordability funds could be used to cover enrollment and outreach costs for these remaining children. We ask the state to continue to fully fund our navigator organizations and provide the necessary supports to handle the increased enrollment needs, as well as fund the state subsidies necessary for the increased marketplace enrollment. We ask the state to sustain the healthcare cost affordability work of the Office of Healthcare Affordability and Transparency by fully funding the office, as well as efforts to improve and expand its effectiveness through current legislation S 4299. With looming threats to federal funding that could cut university hospitals funding by up to $149 million, we urge the state for an allocation that fully funds and staffs University Hospital in order to allow it to continue to be the pillar in healthcare in the community it serves. These requested allocations are vital if we are to sustain the coverage levels we have, continue serving the needs of our New Jersey patients and consumers, and provide healthcare options for those who lose healthcare coverage due to the impending threats to our state's federal healthcare funding. On behalf of the New Jersey Healthcare Coalition, we stand ready to work with the state to advance our shared goal of ensuring all residents continue to have access to quality, affordable healthcare by enacting a responsible, smart budget and policies. Thank you for considering our input.
Thank you, Laura. Valerie Sellers, Cheryl Blackwell.
Thank you, Chairman Sarlo and members of the committee. I appreciate the opportunity to testify before you today. I'm Valerie Sellers, CEO of the New Jersey Association of Community Providers, representing 80 agencies throughout the state of New Jersey. And I will be brief because we've given you extensive written testimony, but we do want to express our appreciation to Governor Murphy for not cutting our rates in the budget. We were told that we might experience catastrophic cuts, and we remained whole. So we're very appreciative of that. We're also appreciative of the funding for the DSP Career Development Program, and JACP works in partnership with the Council of Community Colleges to recruit new DSPs to the field and to encourage existing DSPs to pursue a college education. I suspect this is not going to be the case, but should there be funds available, we'd like to see more people come off the waiting list. We were pleasantly surprised. We thought only 200 come off and more will be leaving those waiting lists. We have over 4,000 people waiting for services in the community. And then finally, I would just ask that you give consideration to restoring funding for CLEP, Community Living Education Project. They are invaluable to the IDD community, absolutely invaluable to the families, to the providers, and to the individuals being served. And I don't know what we would do without them helping individuals with intellectual and developmental disabilities. So I thank you for your time today.
Thank you so much. Rondi Mandelbaum, Rutgers Child Advocacy Clinic.
Yes, thank you.
Hi, Rondi.
Good morning. Thank you for the opportunity to be here. My name is Randy Mandelbaum. I am the Associate Dean for Clinical Education, a professor of law and director of the Child Advocacy Clinic at Rutgers Law School in Newark. I am testifying concerning two budget items. The first concerns proposed cuts to the funding of clinical legal programs for the poor at Rutgers Law School. The appropriation by the governor would cut this funding in half, from $400,000 to $200,000, $100,000 on each of our campuses. These cuts are extreme, especially when taken together with the proposed complete cuts to legal assistance for tenants, which help support our housing clinics on each campus. Rutgers Law School currently has 21 different clinics between its two campuses in Newark and Camden. In these clinics, we serve hundreds of residents of Newark and Camden, as well as throughout the state. This number climbs into the thousands if you include all of our community outreach and educational programming. In Newark alone, we have 13 clinics and routinely have about 130 students per semester in the clinical program. The students are helping parents of children with disabilities get appropriate educational services or federal benefits for their children, representing tenants being evicted from their homes, staying off deportation for immigrant children and adults, and assisting with guardianships for adults who have severe disabilities. These are all life-saving legal services, and what I just mentioned is only a tiny fraction of the many legal activities in which the clinics engage. Without the $400,000 annual appropriation, the clinical program will have to be cut, which will translate into a reduction in services to the community. I ask that the appropriation be restored. The other funding cut I am concerned about is the proposed reduction in funding for the legal representation of unaccompanied children's program. Last year, the UC program received $6 million. The year before, $7.5 million, yet for FY26, only $3 million has been allocated. This will mean less access to attorneys for children, which in turn will lead to children being deported to dangerous circumstances where their very lives will be in jeopardy. An unaccompanied child is someone who, when they arrive in the U.S., was under 18, traveling without a parent or legal guardian, and without any papers. According to government figures, since October 2021, over 17,000 unaccompanied children have been placed by the federal government with relatives in New Jersey. Most children have a viable form of immigration relief, meaning there's a lawful process they can embark upon to put them on a path to a green card. Yet without lawyers, this is not possible, because to avail themselves of this relief, most of the children need to appear in not one, but two courts, state family court and immigration court. With everything going on at the federal level, now is not the time to cut this funding, and certainly not in half. I ask that funding be restored to at least $6 million. Thank you.
Kathy Noonan, representing the Camden Coalition, followed by Deborah Wentz.
Great. Hi, and Lisa Mojica is also with me, so I'm hoping that she'll be turned on to be a speaker.
Okay, can we
thank
get
you,
Lisa
Senator.
Mojica turned on for Camden Coalition as well? Thank you.
Okay, great. Thank you very much. Kathleen Noonan, and I'm the president and CEO of the Camden Coalition, a nonprofit in Camden, New Jersey. We are also a regional health hub, thanks to legislation by Governor Murphy, which was championed, thank you, Senator Cruz Perez, and also Senator Vitale. The Camden Coalition runs demonstration programs targeting people with complex health and social needs and the systems that support them. I think some of you know our work has been featured in the New York Times, in Health Affairs, and I hope you agree with me that the work has really raised the profile of New Jersey as a leader in healthcare. I'm here today to urge you to restore funding for two programs that were zeroed out in the governor's budget. The first is a Housing First program for 50 formerly chronically homeless people. So in 2015, DCA actually awarded the Camden Coalition 50 housing vouchers for the Housing First program. Last year, the governor, it was flat funded from 2015. Last year, the governor cut that in half, and it was not restored by the legislature. This year, the governor has now zeroed out that program. We have been running that program at a deficit, really making up the funds ourselves. So we're on the hook right now with a program where we have vouchers, but no funding. It doesn't make sense to us because this program has incredible data. Of the recipients, their average housing time is over 5 years. Only 20% of them have returned to homelessness. We're seeing a 70% decrease in emergency room use, 30% decrease in inpatient use. We're just really stumped by this zeroing out. The second program that the governor cut is an innovative initiative called Pledge to Connect that has identified thousands of people across South Jersey who are using emergency rooms to get their mental health needs met. And let me turn it over to my colleague Lisa, who can actually tell you a little bit about that program. But key takeaways, we're looking for $750,000 for Housing First and $2.5 million for Pledge to Connect.
Hi, my name is Lisa Mojica. I work at the Camden Coalition in the Pledge to Connect program. Thank you for the opportunity to speak with you today. I use our health information exchange to identify people with mental illness who use the ER a lot. The health information exchange is a database that the state Medicaid program and many hospitals and healthcare providers in the region put their data into, and then we analyze the data and implement public health programs like Pledge to Connect. And one recent patient that stands out for me among the 6,000 people that we've interacted with over the last 4 years is a gentleman that I'm going to call Mr. Jones. He has schizophrenia, substance use disorder, several chronic illnesses, and was homeless in the last 6 months. In the last 6 month period, he used the ERs at 4 health systems 97 times. I said he used the ERs at 4 health systems 97 times in the last 6 months. Our team connected Mr. Jones to outpatient mental health services at Oaks Integrated Care, and not only did they help him get ongoing treatment, but also proper medical care and stable housing. With the persistent support of Pledge to Connect, Mr. Jones met the goals he set for himself. He still occasionally uses the ER, but only for medical purposes. We've partnered with thousands of people to help them achieve their optimal health and well-being and reduce healthcare costs. So I urge you to continue to fund Pledge to Connect. Thank you.
Thank you so much. Thank you, guys. Deborah Wentz. Good to see you again, Deb.
Yeah, thank you. Good morning, Chair Sarlo and members of the committee. Washington's recent clawback of American Rescue Plan funding led to an order for many mental health and substance use treatment and support services in New Jersey to cease on March 31st. With massive cuts to Medicaid, the largest payer of such services looming, now is the time for ensuring the sustainability of our community-based system of care. New Jersey's behavioral health care system has been struggling severely for many years. Rates and contracts don't come close to covering the actual costs of care and certainly do not allow for competitive wages. This system serves our most vulnerable populations, individuals who will be severely impacted by cuts to Medicaid, food banks, SNAP, housing programs, utility assistance, and more. The cuts and potential cuts to these programs, to Social Security and other threats to individual well-being are increasing the stress, anxiety, and depression of all of our citizens, especially those with existing mental health and substance use disorders. The demand for services will only continue to increase. Providers estimate a 33% increase is needed to cover the full cost of behavioral health care, but recognizing the limits of the state's revenue are asking for just an 8% increase, which would be $43.2 million in state funds. Other funding priorities include investing $2.9 million to bring the children's partial hospital rate to $1.12 per hour from the insufficient 77.16 cents now received, and increasing the per child per month rate for care management organizations which serve every child in the children's system of care to $1,200 with an investment of $17 million. New Jersey's children, youth, and adults continue to struggle amidst the national youth mental health crisis, suicide epidemic, and opioid epidemic, and need and deserve the life-saving services that community-based providers offer. Investment in services for both children and adults simply must be a priority of New Jersey's fiscal year 2026 budget, regardless of anything else. Those I've mentioned and others, such as the Community Health Law Project and the CCBHCs and other priorities in my written testimony, need increases just to maintain their services as they strive to meet increasing demand. These vital services provide outstanding returns on investment for the individuals served and the state's bottom line. Please keep New Jersey's mental well-being front of mind as you negotiate the fiscal year 2026 budget. Please contact me for any further information or questions or help that I can provide the legislature. Thank you.
Thank you so much, Deborah. Derry Holland and Jennifer Singer and Elvia Asensio. That will complete our first page.
Chairman Sarlo and members of the committee, I appreciate the opportunity to provide testimony regarding the governor's FY26 budget. I am Derry Holland. I am the CEO of Oaks Integrated Care. We are a large behavioral health nonprofit serving vulnerable children, their families, and individuals with intellectual and developmental disabilities, serious mental illness, and substance use disorder. Last year, we served over 40,000 individuals, and we employ over 1,200 throughout New Jersey. The individuals we serve in our community-based services, our CCBHCs, the Pledge to Connect program, our supportive housing services, and supervised housing for the IDD and SMI are striving to have a quality of life that allows for engagement in their community, access to education, employment, and healthcare. Many of the individuals in our care receive Medicaid for their healthcare coverage, and for our IDD individuals, also their housing support. In January 2025, many of the community-based mental health and substance use services entered a managed Medicaid system. We are grateful for the partnership that we have with the Department of Human Services and other state partners who engaged with us during this very stressful time of change to our service delivery system. The changes in the system have increased the administrative requirements for the provider community without additional financial support to meet the new demands of the managed care organizations. We ask that you support an 8% across the board increase to Medicaid rates to support providers in this new care delivery system. New Jersey has one of the lowest Medicaid rates in the country. The work we do is complicated, complex, compassionate, and critical. Our workforce deserves a competitive wage. An increase to the state Medicaid reimbursement rate would support our ability to provide a competitive wage for the workforce and support the increased costs for all aspects of our business. We are very grateful for the governor's 26 budget did not contain huge cuts for the IDD community. We ask for your support in maintaining what is included in the governor's budget for the IDD community, including the $18 million for a DSP wage increase and funding for 318 people to come off the residential waiting list. The IDD community and other services funded by Medicaid are faced with potentially catastrophic cuts to Medicaid from the federal government. The Medicaid program provides a life for individuals. Without it, the consequences are dire for the most vulnerable among us. We are fiercely advocating to maintain Medicaid funding. We must protect all New Jerseyans from real pain and suffering under such an enormous budget cut, including education, mental health services, and the many programs your constituents depend on. I've also submitted some written testimony with a little bit more detail. Thank you for your continued support to the most vulnerable residents of New Jersey, and your work makes a difference. Thank you.
Thank you so much. Okay. We're going to continue here. Jennifer Singer.
I'm sorry, Chairman. My name is Cheryl Blackwell, and I'm a volunteer with AERP. I believe you skipped over me. You said my name, but other names are coming up.
Okay, we'll come back to you in a minute. We're going to go
Okay, thank you.
Jennifer Singer, Elvia, and then Cheryl Blackwell. Thank you for bringing it to my attention. Jennifer.
Thank you, Chairman Sarlo, and all the members of the Senate Budget and Appropriations Committee for giving me the opportunity to testify. My name is Jennifer Singer, and today I'm testifying from my home. For many, a place to feel love, warmth, and safety, but not all homes feel that way. 20 years ago, my home with my ex-husband and 2 daughters was a place filled with fear, control, and violence. I was a domestic violence victim. I felt isolated, and one night was beaten so badly that the next morning I had his fingerprints bruised into my throat from strangulation. When I realized I needed help, I reached out to the JBWS Domestic Violence Hotline in Morris County. From there, I received community counseling also at JBWS. They taught my daughters and I about safety planning. That safety planning saved us when my older daughter, at just 10 years old, in her pajamas and bare feet, jumped out her first floor bedroom window to get help from a neighbor after a violent attack on me. The police came and arrested him for assault that evening. My 2 daughters, again, 10 years of age, and my baby, who was 11 months of age, and I went to the police station that evening to file for a temporary restraining order. A member of the JBWS crisis response team was there to meet me. Eventually, I was granted a final restraining order, and I was able to start my new life. But the impact of abuse did not stop at just me. My younger daughter suffered immensely. By the age of 7, she began showing signs of trauma, developing OCD and anxiety. As she grew older, the memories of abuse she had suffered during her visits with her father triggered flashbacks, trauma seizures, and panic attacks. But thanks to WWS, she received trauma-focused cognitive behavioral therapy, which helped her confront and heal from the abuse in a safe setting. Today, she is thriving, free from the seizures and panic attacks that once controlled her life. Today, I'm a survivor. I'm a vice president of development for a nonprofit here in New Jersey and a trained crisis response team volunteer for JBWS, meeting victims at the police station. I am happily married. My daughters are thriving. One is a lawyer who volunteers to help domestic violence victims. She is married also to an attorney, and her husband is also a Black Hawk pilot with the United States military. They have 3 beautiful children. My younger daughter is a college student studying to become a high school English teacher and volunteers her time on a crisis hotline. Our lives could have taken a very different path if it was not for the support from a domestic violence organization. My home is now safe, but the scars remain. We have security cameras, and I sleep with a panic button next to my bedside. When you return home today, please remember there are many who will not feel safe in their home this evening. We need to help them. So please continue funding for domestic violence programs in New Jersey. They are a lifeline for those who need help, as they were for my family. Thank you for your support and time.
Thank you, Jennifer, for your courage to share your story in a very, very public domain. Thank you. God bless you. Okay, we're going to do Elvia Asensio, Executive Director of Transition Professionals. Please feel free to introduce the young lady there with you, helping you.
Good morning, Senators.
Okay.
Good morning, Senators and members of the Budget Committee. This is Tiffany. She's a licensed social worker and one of the staff members at the organization. Thank you for the opportunity to testify. My time is on. Yes, thank you for the opportunity to testify. My name is Elvia Asensio. I'm a licensed social worker and the Executive Director of Transition Professionals, a nonprofit organization in Bergen County. We provide comprehensive case management to justice-involved individuals and any reentry services. Since 2020, Transition Professionals has received funding from DCA in the amount of $263,000. This critical funding has enabled us to maintain our operations and retain 2 essential staff members. Without this support, we are not able to keep our doors open. We serve one of the most vulnerable populations in Bergen County, including veterans, seniors, families with young children, victims of domestic violence and sexual assault. Many of our clients live with severe mental illness, intellectual and learning disabilities, substance use disorders, chronic food insecurity, and homelessness. The governor's proposed budget for 2026 eliminates our funding entirely. If this funding is not restored, we will be forced to close our doors, leaving hundreds of justice-involved individuals without the support they need to successfully reintegrate into society.
Good morning. My name is Tiffany Latera. I'm a New Jersey licensed social worker at Transition Professionals. If our doors do close, it will pull a major and often the only lifeline from hundreds of justice-involved individuals and their communities. We service the northern 7 counties of the state and have been fortunate to partner with the New Jersey Judiciary, the NJ Courts, the New Jersey Department of Labor, the Department of Corrections, and many local county divisions as well to expand our services. One of our most notable programs that we hope to continue is our New Jersey Department of Labor sponsored jobs program. The jobs program allowed us to serve over 200 justice-involved individuals with job readiness training, accredited specialized training, and support towards the acquisition of sustainable employment. Those impacted by the justice system are not a hidden group of people on the outskirts of society. They are our community. Our clients have become trained and employed as paralegals, truck drivers, IT specialists, healthcare workers, and more. They have not only become housed, stable, and able to survive, but have become independent, skilled, self-sufficient working professionals. Our clients become taxpayers, voters, degree holders, property owners, business owners, present parents, and out of the cycle of incarceration. We decrease rates of recidivism, partner with businesses to boost the local economy, decrease rates of unemployment, and work to save the lives of the same people you are fighting for each day. The programs we operate work for everyone. We've received this funding from the DCA every year for the past 5, and it is the funding that allows us to do what we love. We are respectfully requesting the restoration and potential increase of this funding so that we can keep our doors open and continue to serve the community. Thank you.
Thank you so much for your testimony. We're going to go up to Ms. Blackwell, Cheryl Blackwell. That'll complete page 1. Ms. Blackwell, there you are. Sorry for the inconvenience.
Oh, no, that's okay. I just wanted to make you aware of it. All right. Well, good afternoon, Chairman Sarlo, Vice Chair Greenstein, and members of the committee. On behalf of AARP's more than 1 million Garden State members and all older New Jerseyans, thank you for this opportunity to speak to you about Governor Murphy's proposed fiscal year 2026 state budget. My name is Cheryl Blackwell, and I'm an advocacy volunteer for AARP New Jersey. We have submitted our written testimony, and I will highlight our members' top priorities. AARP strongly supports Governor Murphy's proposed full funding for the state of New Jersey, anchor, and senior freeze property tax relief programs. Especially in the face of property tax bills now averaging more than $10,000 a year, full funding for New Jersey's property tax relief programs is essential to support older New Jerseyans who want to age in their homes and communities. AARP also fully supports the governor's proposal to make the state's full pension payment for the 5th year in a row. This funding is critical to the retirement security of 800,000 retirees and their families. We were also pleased to report the successful launch of Retire Ready New Jersey this past year and support the continued implementation funding proposed for the program. These modest investments will significantly improve the financial security of private sector workers and their families. We also support Governor Murphy's proposed initiatives that improve health security, including reinforcing New Jersey's role as a national leader in food security by continuing state support for SNAP, continued funding for the expansion of eligibility for the PAD and Senior Gold programs to help with prescription drug costs. This makes New Jersey more affordable for older residents. Governor Murphy's proposed budget includes $10 million to provide full wage replacement to state workers who take family leave to care for a new child. Unfortunately, this proposal discriminates against state workers who also pay for this program through a payroll tax, but are caregivers who need paid leave to care for an elderly loved one or are victims of domestic violence. We urge the governor and legislature to amend this proposal to include full wage replacement for all state workers who are eligible for the family leave program. Nursing homes have received over $250 million in per diem increases alone since fiscal year 22. This year's budget proposal includes an additional $7.2 million in increases. Taxpayer-funded reimbursements keep climbing. Transparency and accountability requirements for the nursing home industry remain wholly insufficient. We urge New Jersey's fiscal year 26 state budget include budget language requiring nursing homes to submit annual, consolidated, audited financial reports as part of New Jersey's rate setting and reimbursement mechanisms. Without fuller transparency, taxpayers, legislators, and administrators cannot know whether increases in reimbursement rates are necessary. We so look forward to working with you in the coming months to finalize a state budget that works for you all. Thank you very much.
Thank you so much. Okay, folks, we're going to go to page 2. We're going to go to page 2 now. Start right from the top. We're going to start with Yusef Maida, Elizabeth Davis, Vanessa Ramelow. Is Yusef with us? Okay. We're going to go to Elizabeth Davis, followed by Vanessa. Elizabeth? Okay, we'll go right to Vanessa.
No, I'm here. I'm sorry. I'm really sorry.
Okay, Elizabeth, Brightside Family, go. You're up.
Great. Thank you so much, Chairman Sarlo. I'm the executive director of the Brightside Family, which is a nonprofit organization that provides affordable housing and support services for older adults. We are Bergen County's only Medicaid-centric assisted living provider, operate its only assisted living program, which provides in-home services for older adults living in subsidized housing who can't afford traditional assisted living facilities and too often are sent prematurely to nursing homes simply because there's no other option. For every resident that's enrolled in an assisted living program instead of going into a nursing home, this program saves New Jersey at least $70,000 per year. With over 40 residents on our program, New Jersey is realizing $2.5 million in savings each year. In addition to saving the state money, programs like ours can ease New Jersey's longstanding struggle to reduce its over-reliance on nursing home care. A report issued in April 2024 by the New Jersey Task Force on Long-Term Quality and Safety called for more state investment in growing home and community-based alternatives, specifically recommending an expansion of assisted living programs as a pathway toward creating more nursing home alternatives for low-income older adults in New Jersey. ALP providers, most of whom are Medicaid-centric providers, face many challenges that impact the model's growth despite its promise. Low reimbursement rates that haven't increased since 2022 make it difficult to keep up with increased labor and operating costs. ALP providers, unlike facility providers, can't bill during the gap period, that time in between a resident becoming eligible for Medicaid and being enrolled in an MCO. This means that we end up providing services for free rather than disenrolling frail residents who have come to rely on the program. Unless New Jersey takes steps to support the small number of Medicaid-centric providers and address some of these challenges, nursing homes are going to continue to be the default and costly option. These challenges not only burden current providers, but they do nothing to incent new providers to serve low-income older adults on MLTSS. As we look ahead, we recognize the need to continue to grow our program in Bergen County. A researcher at Rutgers has identified numerous buildings in our area with hundreds of older adults with high Medicare utilization rates, an indicator that an ALP is likely needed. To grow the program at our current locations, as well as expand into one or two new locations, we are seeking $250,000 in state funding from the 2026 budget. This will ensure our program's continued operation and support its growth, a process that requires outreach, education, licensing, and credentialing. With this investment from the state, we'll serve a growing number of low-income, vulnerable older adults while saving the state of New Jersey as much as $3 million annually by keeping them out of nursing homes. Thank you so much for the time.
Thank you. Okay, we're going to continue on here. Vanessa Romolo. Followed by Evelyn Raimondo, followed by Kim Bryan, followed by Alexandra Concalves Pena.
Good afternoon, Chairman Sarlo,
Good
Vice
afternoon.
Greenstein, and honorable committee members. I'm thrilled and grateful to have the opportunity to testify today. My name is Vanessa Romalo, and I'm the Director of External Relations of Art Pride New Jersey, the state's largest art service and advocacy organization. We represent nearly 400 arts and cultural groups statewide. On behalf of the arts community, thank you to the New Jersey Legislature and Governor Murphy for all your support of the arts. We are so proud to say that New Jersey has risen as a national leader in arts education and state funding for the arts. Since 2003, the statutory appropriation for cultural projects has been key to this success. Today, I urge you to continue supporting the FY26 state budget appropriation of $31.9 million for cultural projects, which supports the New Jersey State Council on the Arts, as well as appropriations for the New Jersey Cultural Trust, the New Jersey Division of Travel and Tourism, and the New Jersey Historical Commission. This past year alone, the State Council on the Arts supported 957 grants for organizations and artists across all 21 counties. These grants addressed mental health, supported after-school programs, provided therapy for veterans, fostered cross-cultural understanding, and this is just the tip of the iceberg when it comes to all the ways the arts support the well-being and vibrancy of communities across New Jersey. We're uniquely fortunate that this funding comes from the hotel motel occupancy fee, a dedicated revenue source, and the arts play a vital role in New Jersey's tourism, offering authentic experiences that attract visitors and drive economic growth. The economic impact of the arts cannot be overstated. According to the most current data, arts and cultural production contributed over $27 billion to New Jersey's economy, employed 138,000 people, and generated $116 million in tax revenue. And for every $1 invested through the State Arts Council, $3 in state tax revenue is returned. I also urge continued support for arts initiatives in other departments. A great example is the NJEDA's Activation, Revitalization, and Transformation Program, the ART program, which fosters partnerships between arts organizations, businesses, and municipalities to boost regional tourism and local revenue. Funding the arts is an investment in New Jersey's communities and economy, generating jobs, tax dollars, and incredible cultural opportunities. Let's continue this momentum by maintaining the current funding level. Thank you very much for the opportunity to testify and for your continued support of arts and culture in New Jersey. We look forward to continuing to serve and support the legislature as a partner and resource in all things arts and culture, and welcome you to connect with us with any questions you may have as you in your ongoing deliberations. Thank you so much.
Thank you, Evelyn Raimondo, followed by Kim Byam. Evelyn? All right, we'll go right to Kim.
Thank you, Chairman Sarlo and members of the committee for this opportunity to testify. My name is Kim Byam. I'm the director of Reach Out and Read New Jersey, and I'm here to ask that you restore the $100,000 that has been granted the last 3 years. I would also like to thank Senator Majority Leader Ruiz for all your past support of this early literacy program. Reach Out and Read is a program that takes place at regular checkups. Medical providers are talking with parents about the importance of reading to their children starting when they're babies. They also give a brand new book to that family to take home and keep, like this one, at every checkup from birth through age 5. That's 14 checkups and 14 important conversations with a trusted provider, the pediatrician, about the importance of bringing books into family routines. These conversations are just as important as the ones about sleeping, eating, and car seats. In fact, the American Academy of Pediatrics policy statement says early literacy promotion is essential for children's health and specifically endorses Reach Out and Read. In New Jersey, there are 100 clinics throughout the state providing this program to our most vulnerable families. 80,000 families each year at 160,000 checkups. 85% of these families do not use private insurance. Reach Out and Read is in federally qualified health centers, at hospitals, at nurse family practice partnerships, and at small private practices. And every day, parents are learning from their Reach Out and Read providers how important their role is as their baby's first teacher on that baby's brain development, language development, and mental health. The books that are given are just right for that child, the right language, the right developmental stage, and the right pictures that act as windows and mirrors. Very often, these are the only books in the home. For the last 3 years, this funding has helped us expand the program to include the 4 regular checkups that happen between birth and 5 months at 33 separate clinics across the state. Reach Out and Read is backed by science. It